Hello everyone, welcome to Pediatrics by Dr. Anand. Is my voice audible to everyone? Please put a message in comment section. Thank you. Hello everyone, how are you? कैसे आप सब लोग? How are you? How's everyone going? So this is the beautiful Unacademy NEET PG platform. I hope my voice is audible to everyone. Thank you. In this beautiful Unacademy NEET PG platform, first of all, my name is Dr. Anand. This is the March. This is the month of the March and the week 3. We have this amazing, beautiful, what we called live free test. So guys, give as many tests as possible. It will be really nice for you. Also, at the same time, in the Unacademy, we have something known as Unacademy Lite. We have this beautiful plan coming now for 2 months because March is almost coming to an end. So April and May, some beautiful plan we have basically, and yes, something known as Unacademy Lite. Okay, that you should know. It's a very beautiful plan. And yes, hello everyone. Good evening. Hi Priya. Hi Ahmed. Very important. And hi Ashutosh. And in the Unacademy, most importantly, yes, we have this cardiology test, cardiovascular test, which is happening on March 20th, and 40 questions, 60 minutes you'll be getting for that. And also in the Unacademy, we have something known as Plus subscription, something known as Iconic subscription. Hello. Hi Abhimanyu. Hi Manoj. Hi Chakravarti. Hi Julie. Good to see every one of you. Very nice. And yes, beautiful. So in the Iconic subscription, we have the Unacademy platform and the what we called Prep Ladder subscription. That is the Iconic subscription. Congratulations to the amazing toppers for the FMG batch. The people who work so hard. Their names are there, and I want you all to work really hard for your exams. Chakravarti says today test ho gaya sir. Today now I'm gonna ask you question. In today's class we're gonna talk about syndromes. I'll be showing you pictures. You have to tell me which syndrome is this, and we're going to talk some associated points of that specific syndrome. Okay, hello, hi Appy, hi Nishi, hello everyone. And yes, we have this all educators revision batch, which is going amazing. The other batches are, we have the FMG batch, then we have the NEET PG subscription. I told you the Plus subscription, Iconic subscription, and the Light subscription. Okay, that's what. Hi Appy, hi Nishi, hi Vaidehi, hi Ravi. Hello everyone. Today's class we're gonna talk about, very importantly, syndromes. I'm gonna show you pictures. I'm gonna show you some amazing pictures. You have to tell me which syndrome the picture fits into and associated points of that. This session will exactly last for 30 minutes. 11:30 I will stop this session, and we're going to talk about the part 2 of this session tomorrow. So before starting any amazing segment, we always have a motivating quote, and today's motivating quote is, what comes easy won't last long, and what lasts long won't come easy. What do you think? Do you agree with this? Yes or no? Yes, a very beautiful thought process. So very nicely, what comes easy won't last long, and what lasts long won't come easy. So what will last long? Your PG seat will last long forever, and that won't come easy. You have to really work hard for that, right? Coming to the first picture, anyone coming to the first picture, what do you think? If this picture comes in the NEET PG paper, what are you going to write? Who will tell me? Osama, Kamal, Pradeep, Giri, Pragya, Nishi, Vaidehi, so many people are there today. What are the findings? What are the findings basically? Kamal, what do you think? Anyone? Yes, I'll give you 5 seconds. Exactly, very good. Can we appreciate a prominent forehead? Can we appreciate a prominent forehead? Number one, which is nothing but known as macrocephaly, which is known as macrocephaly. Exactly. Then we have, very importantly, can you appreciate flushed cheeks? Flushed cheeks, yes. And most importantly, pointed chin. Pointed chin. Okay, pointed chin. So where do you see macrocephaly with flushed cheeks and pointed chin? Exactly. So yes, very true, very true. Osama is very right. You will see this in Sotos syndrome. You will see this in Sotos syndrome. Very good, Osama, very good. So what are the other points? Can anyone tell me 2 extra points of Sotos syndrome? Macrocephaly, flushed cheeks, and pointed chin. Yes, I agree with you. Any other point? Any other point of this one, Sotos syndrome? Do you remember large for gestational age, baby? Is Sotos syndrome a case of large for gestational age baby? Yes or no? Yes, right. So how do you define large for gestational age? Weight for age more than 90th centile. You remember, right? The causes of large for gestational age babies are State Bank of India extra count, S for Sotos syndrome, B for Beckwith-Wiedemann syndrome, I for infant of diabetic mother, and E for erythroblastosis fetalis. Yes or no, Osama? समझ में आ रहा है? So this beautiful picture is nothing but a case of Sotos syndrome. Sotos syndrome, exactly. Yes, Osama is right. Large for gestational ages, weight for age more than 90th centile. Very good. If I show you this picture, now picture number 2, exactly. Very good, Chakravarti. Yeah, picture number 2. If I show you this picture, what do you think? The associated points are this baby is having pinna abnormalities. This baby is having pinna abnormalities and history of polyhydramnios. What do you think? Pinna abnormalities, and also this baby is having earlobe creases. I'm gonna show you again. Very importantly, earlobe creases, pinna abnormalities, and very importantly, kind of a large baby or a big baby. What do you think? Hypothyroidism? No, not hypothyroidism. Again, look at the baby very carefully. Pinna abnormalities, history of polyhydramnios, and earlobe creases. The baby is having earlobe creases. Manu says Wilson Walker syndrome. Nahi. If I said this one, okay, now looking at this picture, who will tell me? Anyone? By looking at this picture, what can we appreciate? Who will tell me? This pinna abnormalities, and anyone, any random guesses by looking at this picture? Yes, very good. Very, very, very good. This is a case of Beckwith-Wiedemann syndrome. This is a case of Beckwith-Wiedemann syndrome. What are the important points of Beckwith-Wiedemann syndrome? Number one, can we appreciate macroglossia? Yes, very importantly. So can we appreciate macroglossia? Then we have microcephaly, macroglossia, microcephaly, and then we have the hemihypertrophy of limbs. Yes or no, Osama? याद है कि नहीं याद है? Yes, Philadelphia says hello. Hello, buddy. What's up, Nikhil? कैसे हैं आप सब लोग? Nikhil is very good student. A very good student nowadays. He's answering very well. So hemihypertrophy, hemihypertrophy of limbs. Yes or no? What are the other important points? Exactly. Very good. So the patient will have, very importantly, macroglossia with microcephaly with hemihypertrophy of limbs, most importantly. And these babies, basically, what is this? These baby can have omphalocele, or these baby can have Wilms tumor. This baby can have Wilms tumor. Can anyone tell me how do you differentiate omphalocele from gastrochysis? Ushri, this one, Priya, exactly. How do you differentiate? What is, if this is omphalocele, then what is this picture? One second. What is this picture? Anyone? Very good, Osama. Very good. What is this picture? This is also omphalocele. Can anyone would like to comment on this picture? Hmm. Exactly. When the intestinal contents are out, when the intestinal contents are out and they are not covered in a sac, can we see the intestinal contents are out and they are not covered in a sac? This is known as gastrochysis. This is known as gastrochysis. When the intestinal contents are out and are not covered in a sac is known as gastrochysis. And when the intestinal contents are out and they are covered in a sac, they are covered in a sac. Very good. This is known as omphalocele. That is known as omphalocele. So most important second syndrome, the findings are like Beckwith-Wiedemann syndrome. The findings are macroglossia with microcephaly, with hemihypertrophy of limbs, and these babies can have increased incidence of omphalocele, umbilical hernia, and Wilms tumor. Please put a like button. Are you able to understand? Yes or no? Osama, समझ में आ रहा है? Yasin, Priya, everyone, are you getting it? This class will be exactly for 30 minutes only. 10 minutes are over, 20 minutes are left. Okay, part 2 of this class, we'll do it tomorrow. So 30 minutes as much as possible. Let's gather more points. What are the other syndromes associated with Wilms tumor? Who will tell me? Very common question. What are the syndromes associated with Wilms tumor? One is Beckwith-Wiedemann syndrome. Everyone knows about it. Beckwith-Wiedemann syndrome is associated with Wilms tumor, right? What are the other syndromes associated with Wilms tumor? So most importantly, the other syndrome associated with Wilms tumor are, anyone? Exactly. Very good. It's nothing but Denny-Drash syndrome, Vagar syndrome and Beckwith-Wiedemann syndrome. Are you understanding? Very good, very good. Ahmed, Nishi, Sambarth. Yes, beautiful, beautiful answer, Bhavani. The syndromes associated with Wilms tumor are Beckwith-Wiedemann syndrome, Vagar syndrome, and Denny-Drash syndrome. If I talk about Vagar syndrome, anyone? Vagar. What is W? What is A? What is G? And what is R? Can anyone tell me what is the full form of Vagar syndrome? What do you think? Very good. So the full form of Vagar syndrome, W for Wilms tumor, A for aniridia, G for genitourinary abnormalities, and M for R for retardation, mental retardation. This is the very important full form of Vagar syndrome. I'll repeat again. What are the three important syndromes associated with the Wilms tumor? The answer is Denny-Drash syndrome, Vagar syndrome, and Beckwith-Wiedemann syndrome. The important points of Vagar syndrome: W for Wilms tumor nephroblastoma, A for aniridia, G for genitourinary abnormalities, and R for retardation, mental retardation, that you should know. Okay, next question. If I show you this picture, the third syndrome, if I show you this picture, can anyone tell me what are the important points for this syndrome? Let me show you a closer picture. Yeah, if this picture, this is a very nice picture, guys. What do you think? Anyone? Anyone? Yes. Very good. Kamal is right. Vaidehi is right. Nishi, Sambarth, Abhimanyu, and Arvind and Osama Sheikh. Sandal gap, nahi bro, sandal gap nahi hai ye, but I'm happy you tried. Yes, Kamal is right. This is nothing but most importantly, have you heard of rocker bottom feet? ये क्या है बेसिकली? रॉकर बॉटम फीट, जो उसके पैर हैं, जो पैरों की कन्वेक्सिटी है, दिस इज मोर लाइक अ रॉकर बॉटम फीट. एग्जैक्टली. रॉकर बॉटम फीट इज विच ट्राइसोमी? Rocker bottom feet is trisomy 18. Trisomy 18. What is the full form of Edwards syndrome? Like mnemonic, we have nothing but ROCKY. Rocky M. Rocky M. R for rocker bottom feet. O for overlapping digits. Overlapping digits. Okay. R for rocker bottom feet. O for overlapping digits. C for cardiac defects. K for kidney defects. Y for microcephaly. Y for microcephaly, and M for mental retardation. Mental retardation. Yes, exactly, exactly. Okay, Osama says दोनों वर्ड में confusion हो गया. कोई बात नहीं, dear Osama, you are working so hard. Like I'm so impressed by you. You're working really very 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 hard, bro. गलतियां करो. Every one of you, I tell you, do mistakes. Why? Because number one, mistakes are a proof that you are actually trying to clear the exam, and do lot of mistakes here, because the more mistakes you do here, the more you will remember that okay, yes, I did mistake in the live class. Okay, I find in the exam I will not do the mistake. So what is this syndrome, guys? This is nothing but Edwards syndrome. Anyone? Trisomy 18, 13 and 21. Which is trisomy 13 and which is trisomy 21? Yeah. Very good. So trisomy 18 is Edwards syndrome. Trisomy 13 is Patau syndrome. Very good. Trisomy 13 is Patau syndrome, and trisomy 21 is Down syndrome. Trisomy 21 is Down syndrome. Very good. Are you understanding? Let's have a quick revision again. Again, in the beginning of the syndrome, number one, we saw the Sotos syndrome. Very important. Macrocephaly, flushed cheeks and pointed chin. LG babies, and they will have natal teeth. Do you remember, guys, natal teeth? What are the important causes of natal teeth? हाँ जी, ओसामा आगे आ जाओ. हाँ जी. Does a newborn baby have teeth? No. When does the first teeth appear in a baby? बच्चे में पहला दांत कौन सा आता है? Which is the first teeth to appear in a baby? Anyone? Exactly. The first teeth to appear in a baby is a lower central incisor, which comes by 6 to 7 months. Lower central incisor, which comes by 6 to 7 months. If a newborn baby having teeth, the mnemonic was PEES. The mnemonic was PEES. Anyone? Do you remember, Osama? A newborn baby having teeth. What are the differential diagnosis? P for Pierre-Robin syndrome. E for Ellis Van Creveld syndrome. Another E is epidermolysis bullosa, and S for Sotos syndrome. Sotos syndrome. Yes. Exactly. Osama is right. Khargosh ke dant, the lower central incisor, are the first one to come. The first temporary teeth to appear in a baby is Lower central incisor. Which is the first permanent teeth to appear in a baby? Exactly. The first permanent teeth to appear in a baby is the first molar. M1, first molar. When does it come? 6 to 7 years. So how will I remember? See, remember 6 to 7 months, 6 to 7 years. The first temporary teeth to appear in a baby comes by 6 to 7 months. That is lower central incisor. And the first permanent teeth to appear in a baby comes by 6 to 7 years. That is the first molar. Then also we understood about Beckwith-Wiedemann syndrome. The baby can have pinna abnormalities. The baby can have earlobe creases. The baby basically will have a macroglossia with microcephaly with hemihypertrophy of limbs, and they have increased incidence of Wilms tumor or omphalocele or umbilical hernia. Done. This part is over. Okay. Perfect. 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 Yeah, then also we covered something about very important rocker bottom feet, where you see in Edwards syndrome, the mnemonic is Rocky M, R for rocker bottom feet, O for overlapping digits, C for cardiac defects, K for kidney defects, Y for microcephaly, and M for mental retardation. Edwards syndrome is trisomy 18. Trisomy 18. So this is trisomy 18. This is the rocker bottom. I asked in the previous classes also, what is the meaning of rocker bottom? That our grandparents use this chair which has a convexity like that. So this only convexity the baby's foot will be having. So rocker bottom, rocker bottom. यहाँ से नाम पड़ा है. Okay, that you should know. Okay, next question. Yeah, if I show you beautiful video, beautiful video. If I show you this video, now can anyone tell me how? Let's start this video. What are the findings? Yeah, what is the finding? What is the finding you can see in the slide? Who will tell me? Anyone? What is the finding? What is this? Can we appreciate that there's a what do you call it? Exactly, yes. Can we appreciate there's a space between the great toe and the second toe? What do you call it? This is known as sandal gap. This is known as sandal gap, right? Yes or no? Exactly. This is known as sandal gap, right? And okay, let's move further after this video. And once I saw the sandal gap, and what are the other findings we are appreciate in this baby? Let's see. This is sandal gap, okay. And this one, now this, yes. What can we appreciate? Can anyone put any point here? Exactly. Very good. Lakshmi, Kamal, Manoj, to be a better human, Khan, and Rabi, Sankar, Nishi. Very good, very good. People who are applying are hugely there. You will definitely clear the exam. What can we appreciate in this, guys? Can we have it? Yes or no? What is this? Can we appreciate, I would say, epicanthal folds? Yes or no? Can we appreciate epicanthal folds? Number one. Can we appreciate depressed nasal bridge? Depressed nasal bridge. Can we appreciate, or if I draw a straight line, can we appreciate low set ears? Low set ears. Can we appreciate squint? Can we appreciate a flat facial profile? Flat facial profile. So these are the amazing points of the Down syndrome. Okay, which syndrome it is? Down syndrome. Down syndrome, very importantly. That's what. So I would say, and also the way the baby is looking at you, the way the baby is looking at the father, kind of, you can say it's a case of developmental delay. Do you see decrease IQ or normal IQ in Down syndrome? Yes, very good. You say decrease IQ. Yes, very good, very good. So yes, Nishi is right. Osama, Bhavani, very good. Everyone is perfectly right. Exactly. 10 more minutes, then this class is gonna over. It was a short class today. So yes, the points we can appreciate are number one, very importantly, flat facial profile, epicanthal folds, very importantly, depressed nasal bridge. The child is kind of having a developmental delay, very importantly, and also at the same time, which is the most common, very important question, which is the most common congenital heart in Down syndrome? The most common congenital heart in Down syndrome is ostium primum. Ostium primum type of atrial septal defect, and the most specific is endocardial cushion defect. The most specific is endocardial cushion defect, and the most common is, I would say, ostium primum type of atrial septal defect. So Down syndrome, this also baby suffering from Down syndrome. The baby will have a, can we appreciate a mouth open and a tongue protruding out? like this. The tongue will be out and mouth will be wide open. That you should know. And mongoloid slant, very very important, guys. Can anyone tell me what is the meaning of mongoloid slant? What is mongoloid slant and what is anti-mongoloid slant? Who will tell me? Yes or no? Fast, fast, fast. जल्दी बताइए. Yes, what is mongoloid slant and what is anti-mongoloid slant? Who will tell me? It's a very simple one. Exactly. Very good. Osama is answering so good. Everyone is answering amazing. So yes, upward slanting of eyeballs. Very good. Upward slanting of eyeballs. That is known as mongoloid slant. आंखें जो उठी, लड़कियां अगर मेकअप करती हैं और थोड़ा ऐसे उठे हुई आंखें उठी अगर होती हैं, upward slanting of eyeballs is known as mongoloid slant, very importantly. And downward slanting of eyeballs is known as anti-mongoloid slant. And examples, exactly, very good. Nishi, Osama, Vaidehi, Chakravarti, Sandeep, beautiful. Mongoloid slant example is of course Down syndrome. An anti-mongoloid slant example is Noonan syndrome. The example is Treacher-Collins syndrome. Yes or no? Noonan syndrome, Treacher-Collins syndrome, and what else? Cry-Do chart also. Cry-Do chart also, we have the syndrome which basically will have a क्या बोलते हैं उसको, anti-mongoloid slant. Perfect. Very good, very good. What is this picture, anyone? If I show you just this picture, only this picture if comes in exams, what you going to write? This can we see what is this, anyone? Exactly. This is nothing but epicanthal fold. There's nothing but epicanthal folds. This is the fold. This is the fold basically over the epicanthal. So epicanthal folds, right? Very good. Epicanthal fold. Yes. Right. Epicanthal fold is a skin fold of the upper eyelid covering the inner corner of the eye. Can we read this line? Epicanthal fold is a skin fold of the upper eyelid. Can we see this is the upper eyelid? So this epicanthal fold is the skin fold of the upper eyelid covering the inner canthus, covering the inner corner, covering the inner corner of the eye, and that is known as epicanthal folds. Very good. Perfect, beautiful. And Down syndrome babies, other thing can be, what all can we appreciate? Can we appreciate developmental delay? Yes. Can we appreciate depressed nasal bridge? Yes. Can we appreciate down ears or low set ears? Yes, right? We can appreciate, right? Depressed nasal bridge, low set ears, and developmental delay. Also, can we appreciate eyes? Yeah. Eyes. In the eyes, one eye was mongoloid slant. What is this picture, guys? Can anyone tell me what is this picture? Any question mark? What do you think? Osama? Anyone? Yes. Very good. Very good. What is this picture? Who will tell me? Yes. Yes. This is known as brush field spot. Very, very important. This is known as brush field spot in the iris. It's nothing but brush field spot in the iris. This is known as, very importantly, eye finding in a case of Down syndrome. ये जो होते हैं क्या बोलते हैं इनको? Brush field spots. Okay, that you should know. So yes, brush field spots in the iris, epicanthal folds, and mongoloid slant. That also we finish. Very importantly, yes. What is this C से शुरू होता है? What is this, guys? What is this, my friends? So 5 more minutes and this class is over. Exactly. Gina is right. Down syndrome baby can suffer from Alzheimer. Yes, they can definitely suffer from Alzheimer. So this one's an incurvature of digit. This is known as clinodactyly. Is known as clinodactyly, incurvature of the digits. Very good. Julie Tigdi is very right. Incurvature of digit. Can you see congenital hypothyroidism in a case of Down syndrome? Yes, the baby's metabolism goes very slow. Down syndrome babies have lot of constipation issues also, and they can land up into congenital hypothyroidism. Yes, clinodactyly is right. Yes, congenital hypothyroidism is right, and congenital heart disease also is very common. Okay. Yeah, this is a good question. This is a good question. Which is the most common type of atrial septal defect? If I would say there are two questions, which is the most common type of atrial septal defect in Down syndrome, and which is the most common type of atrial septal defect in cardiology? CVS topic if I talk about atrial septal defect. Do we have any change in the answer here, or it is just the same? Who will tell me? Anyone? Arvind? Yes, Nishi? Yes, very good. The most common type of atrial septal defect in a case of Down syndrome is ostium primum. ostium primum type of atrial septal defect. And the most commonest type of atrial septal defect in cardiology topic, it will be ostium secundum. Ostium secundum type of ASD is common in normal cardiovascular topic of ASD, and most common type of ASD in Down syndrome will be ostium primum type of atrial septal defect. And most commonest type of atrial septal defect per se, if I'm talking about cardiology topic and the atrial septal defect is the topic, then the most commonest type of atrial septal defect will be ostium secundum. Ostium secundum, that you should know. Okay, yeah. Exactly. And Down syndrome, if you see this patient, can Down syndrome patient can go to Alzheimer disease? Yes, yes or no? So yes, this Down syndrome baby can have Alzheimer. Most importantly, yes, the first and second vertebra, basically atlantoaxial instability, atlanto axial subluxation, I would say, or displacement basically is very common in a case of Down syndrome. I'll give you a toffee if you can tell me, most important, any other subluxation can we remember in pediatrics? Atlantoaxial subluxation is there in Down syndrome. Any other subluxation? Can you help me, guys? Yes or no? Osama, exactly, very good. So atlantoaxial subluxation is there in Down syndrome, and superotemporal subluxation of lens. Superotemporal subluxation of lens is there in Marfan syndrome, and remember him. So homocystinuria will have inferior-medial subluxation of lens. I'll repeat again. Down syndrome babies will have atlantoaxial subluxation of the disc. Marfan syndrome will have superotemporal subluxation of lens, and homocystinuria babies will have inferior-medial subluxation of lens. And remember which, yes, everyone is right. The baby can land up into AML also, acute promyeloblast leukemia, M7 also. So yeah, it can lead to these problems. Yes. Yeah, next one. Yeah, and the yeah, of course, everyone knows about it. Down syndrome babies will have a flat occiput. They will have a flat occiput. They will have a open, wide anterior fontanella. What is the shape of anterior fontanella and when does it fuse? Can anyone tell me fast? What is the shape of the anterior fontanella and when does it fuse? Exactly, very good. Yes, Pragya is right. Amu, Pragya, Priya, Abhimanyu, Kamal. Very good. Yes. Last 3 minutes left and this class is over. What do you think, guys? What is the exactly? Yeah, the shape of the anterior fontanella is diamond shape. Number one, it fuses by 8 to 18 months. The anterior fontanella fuses by 8 to 18 months, that you should know. Very good, perfect answer, beautiful answer. Yes, so a flat occiput, open wide anterior fontanelle, and O means round face. Yeah, that's true. This part is over. And yes, what can we appreciate in these two slides? Can we appreciate a single palmar crease? Can we appreciate a sandal gap? Very classy, very classy picture of sandal gap and single palmar crease. Yes, very true. And very importantly, short head. This is important. Which is the craniosynostosis you will see in Down syndrome? The answer is brachycephaly. Can anyone help me and tell me that brachycephaly? This is the last question and this class is over. It's 11:29. The class was there exactly for 30 minutes tonight. So guys, brachycephaly. Can anyone tell me brachycephaly is premature fusion of which suture? Anyone? Abhimanyu, Osama, Sandeep, yes, Priya, Farhas. Yes, very good. So brachycephaly is exactly, Nishi is so right. So most importantly, yes, you are right. What do you call it? If I talk about the skull basically and various sutures which are involved, guys, then this right. So we have something known as metopic suture. Then we have something known as coronal suture. Then we have something known as sagittal suture, and then last one is this one is the lambdoid suture, right? Premature fusion of the metopic suture causes anyone? Trigonocephaly. Premature fusion of the metopic suture causes trigonocephaly. Premature fusion of the coronal suture causes, कहाँ चला गया? Premature fusion of the coronal suture causes anyone? Brachycephaly, right? Exactly, brachycephaly. Premature fusion of the sagittal suture causes dolichocephaly, right? And the other name of dolichocephaly is scaphocephaly. And last but not the least, premature fusion of the lambdoid suture. Lambdoid suture will cause plagiocephaly. Very good, very good. Osama is answering right, Sandeep is answering, and Julie, very good. ये सब पता होने चाहिए. These you should know. Okay, I should not know, you should know. It has come in exams, so you must know. Okay, remember this picture is so important. So brachycephaly is because of premature fusion of coronal suture. Dolichocephaly is because of sagittal suture, and plagiocephaly is because of lambdoid suture. This is nothing but very important craniosynostosis. And Down syndrome, which craniosynostosis is important in Down syndrome? Brachycephaly is very common in a case of Down syndrome. Brachycephaly is very common, that you should know. And yeah, Cruzen syndrome also will have brachycephaly, that's true. And among these various craniosynostosis, plagiocephaly, brachycephaly, dolichocephaly, trigonocephaly, which craniosynostosis is very commonly seen? The answer will be dolichocephaly. The most common one will be dolichocephaly. Down syndrome, you will see what you called brachycephaly. Cruzen syndrome also you will see coronal suture involved, brachycephaly. Okay, that's it. That finishes today's class. It was a quick 30 minutes revision. I hope you guys have liked the class. Thank you so much everyone, for this wonderful participation. In the tomorrow's class, we're gonna talk about lot of stuff. We're gonna talk about, very importantly, single bubble sign, double bubble sign, triple bubble sign. Then also we're gonna talk about other syndromes like Cruzen syndrome and many other, like fetal alcohol syndrome. Tomorrow we're gonna talk about these conditions. Tomorrow evening we have a class. Remember guys, from tomorrow back to back we'll be having exactly, yes. Yes, exactly, Osama. Okay, Osama, मैं एक लाइन गाना गाएंगे, ठीक है? So tomorrow, guys, we have a class at 5:15 p.m. and then we have a class at 8:30 p.m. Without fail, we have a class at 5:15 p.m. on the Unacademy app, where we're gonna talk about this continuation of the syndromes. Basically, we have 50 syndromes to cover. We have only covered 5 syndromes. 45 syndromes still are there. And 8:30 p.m. class also, we're gonna continue the same syndrome class. Okay. Thank you so much everyone for this wonderful participation. Exactly, yes. And before leaving, we always have a motivating quote, and the last motivating quote for tonight is, लोग आलसी नहीं हैं, लोग आलसी नहीं हैं, उनके पास सिर्फ ऐसा लक्ष्य नहीं है जो उन्हें प्रेरित कर सके. सो प्लीज बिफोर स्लीपिंग थिंक अबाउट दिस. लोग आलसी नहीं हैं, उनके पास सिर्फ ऐसा लक्ष्य नहीं है जो उन्हें प्रेरित कर सके. सो ऑलवेज यू मस्ट हैव सम मोटिव, सम क्रेजी मोटिव अगेंस्ट यू, लाइक फॉर योर लाइफ. अदरवाइज जिंदगी जीने का क्या मजा? व्हाट इज द यूज ऑफ लिविंग लाइफ लाइक दैट, राइट? सो दैट्स व्हाट. थैंक यू सो मच एवरीवन. एंड बिफोर लिविंग, just one line of a song, because Osama is requesting a very old song. So सब गाते हैं, सब ही मदहोश हैं, हम तुम क्यों खामोश हैं, साजे दिल छेड़ो ना, चुप हो क्यों, गाओ ना, आओ ना, आओ ना, आओ ना, आओ ना, चुप हो क्यों, बोलो ना, कुछ कहो, गाओ ना. Thank you everyone for this wonderful participation. And tomorrow we're going to talk about other things. Pragya says, sir, please revise Treacher Collins syndrome once. कल करेंगे. Tomorrow evening we gonna revise Treacher Collins syndrome. Just remember, Treacher Collins syndrome, गांधी जी के 3 बंदर. गांधी जी said, don't see the bad stuff, but those people saw, they got coloboma of the eyelid. Gandhi ji said, don't hear the bad stuff, but they heard it, they got what is called deafness basically, and ear abnormalities. Gandhi ji said, don't speak the bad stuff, but they spoke the bad stuff, they got hypoplasia of the cheeks or microkinesia. So these all are the points of Treacher Collins syndrome. The mnemonic is Gandhi ji ke 3 मंदिर, and they were very dominating students, these teacher colon. So the inheritance is autosomal dominant fashion and TCOF1 gene mutation. Thank you so much everyone for this wonderful participation. Tomorrow evening 5:15 p.m. and tomorrow night 8:30 p.m. See you without fail for the whole next week with Unacademy. Thank you. Bye bye. Take care. ख्याल रखो.